E at ICMR National Institute for Research in Tuberculosis, Chennai. Dr. Isa is a leading researcher in clinical trials, TB vaccine, pediatric TB, and other communicable diseases. His outstanding contributions to biomedical research were recognized with the Major General Salah Peace Award in the year 2010 by Indian Council of Medical Research for his remarkable work in communicable diseases. His extensive research experience includes serving as a site principal investigator for TB vaccine study and principal investigator for science study on shorter TB treatment in children. He has also led research for India's national certification toward TB-free status. With this remarkable introduction, may I invite Sir to present on the topic integration of Unani medicine with reference to collaborative work on tuberculosis journey. Ladies and gentlemen, please give a big round of applause for Dr. Sayed.
Please bear with me, I would finish off within 10-15 minutes, I suppose. So, I will just go forward with whatever the rest of the speakers have just said about collaborative research and integrative research. So this is a collaborative research project in tuberculosis. I will just go as a journey with the Unani Pharmacopoeia formulations with anti-tuberculosis treatment. So you all know what is integrated healthcare means. So it is nothing but going for a quality of care, enhancing access and meeting the holistic needs of the patient. And this is basically a person-centric care. The person wants all good things benefited to himself. So non-communicable and chronic diseases, you all know it needs long-term care, 1, 2, holistic care, 3, multidisciplinary care, and all this can be achieved only when there is a good coordination with all the caregivers. Yes, surely it will have a good public health benefits, so the outcome will be good. 1, 2, it strengthens the health system with various stakeholders coming to a point and integrating and giving the services. And also, it gives lot of economic and social benefits to the patient as well as to the nation. Yes, when there is benefit, there would be some challenges also, and there would be some demerits also. The main challenge here is the lack of research with integrative approach. 1. Second is issues with availability of standardized formulations with respect to Indian system of medicine. Third, increasing cost due to non-availability of raw materials. Third, ethical and regulatory challenges. Then, organization or system resistance within the system, within the community. So, all these challenges we need to overcome to have an integrative approach. To promote integrative approach in NCD or any chronic illness, I would urge all the Ayush councils to take up all these preclinical studies going for a chronic toxicity. As I told, it is a when you are integrating, when you are dealing with chronic diseases, you are dealing for a longer term of care, holistic care. Then all this can be possible only you have drugs which can be given for a longer period of time. So you need chronic toxicity. 1. Second is preclinical studies on drug-drug interaction is very important. So, because if you are mixing two drugs, even within the FDCs, so fixed dose combination we say, so within that if you mix the drugs, there are some instances it can potentially increase the drug efficacy of some drugs, it can also decrease the efficacy of some drugs. So, which warrants a preclinical study. So, all this drug-drug interaction must be seen and must be documented. Third is drug-drug efficacy interaction. As I told, the efficacy interaction, safety interaction, all this need to be documented. So, this is one of the kind of study which has interaction safety, which has been established, and we are going now with the interaction efficacy of this formulation. So, we have taken this is one of the study which has been concluded, effects of co-administration of Unani Pharmacopoeia formulation. So we have taken two formulation which has been given by the Unani Council, co-administered with category 1 ATT drugs. So as you know, TB is a major global health as well as the Indian problem, health problem. Increasing MDR is another issue. So these two formulations, we took it as a research mode because it was prescribed commonly for the treatment of TB-like conditions. So these formulation ingredients had a major three already proven effect, that is hepatoprotective, immunomodulatory, and it has some aspects of antibacterial property. Hence, it was proposed to validate these activities in these formulations, Unani Pharmacopoeia formulations. So, we undertook co-administration of this Unani Pharmacopoeia formulation with ATD, seeking that it may improve the liver and kidney function and the patients will have a better quality of life. Initially, we proposed this study in MDR TB so as to reduce the ADR occurrence. But to go forward, our IEC advised to go with interaction safety studies along with DSTB, so drug sensitive TB, to initiate the thing. So we did the same interaction safety with category 1 ATTs. So methodology is we gave every drug individually as well as all the drug altogether in the rats, preclinical. So we saw the effects of kidney function, liver function, hematological parameters as well as category 1 drug levels in those rats blood at different time points like 14th day, 60th day till the treatment end, that is 180th day, so that to ascertain that it doesn't have any excursion of these drugs or depression of these drugs, so that it may hamper the efficacy of these drugs. So results of this preliminary work, the co-administration improved the liver and kidney functions. The earlier study has revealed that the co-administration of these formulations improved the plasma peak concentration of rifampicin without altering the liver and kidney function. So it actually increased the rifampicin levels to suboptimal level. So it was not above the therapeutic level, it increased towards the suboptimal level. So since it doesn't cross the suboptimal level, it never altered the kidney and liver functions. In fact, it gave a good efficacy results also. Third is, the study also demonstrated mild to moderate histopathological changes in animals treated with category 1 at the end. In those who have been treated with category 1 as well as Unani Pharmacopoeia formulation, these changes were abrogated and these changes were never found at the end of 180th day when we sacrificed these animals. Hence, the study suggests potentially effect of Unani Pharmacopoeia formulation on rifampicin and its protective effects on liver and kidney against the adverse events resulted due to category 1. Batteries. Can you just next slide. So this study was published in 2021 in Journal of Complementary and Integrative Medicine. Next. So to go way forward, we wanted the interaction safety of co-administration. So we now know interaction safety of this Unani Pharmacopoeia formulation with category 1 APT. So we now went to the IEC to go for a clinical studies. But again, the IEC gave us another job to see the interaction safety and efficacy. So we saw in healthy rats, healthy animal. So preclinical study was done in a healthy rat population. So healthy preclinical was done. So they wanted us to do the same interaction safety as well as efficacy in TB infected animal model with guinea pigs. So then we came up with the present study. Next. This is nothing but evaluation of anti-tubercular and immunomodulatory activities of UPF through in vitro and in vivo studies. So we designed a in vivo and in vitro and ex vivo studies so as to say that yes, it is effective, it is safe, and it has interaction efficacy also. So this is a study initiated last year. We have completed 1 year. We have some data on it. I will discuss on this. This is an unpublished data. So we are doing animal studies, lab studies at our ICMR Institute, and the lab studies are done with the Jalna Institute at Agra, and the drug procurement, standardization, everything is done and given to us from this institute. Next. These are the objectives with respect to ex vivo, in vivo, and in vitro studies. We would see one by one. Next. As I said, yes, all these materials for Unani Pharmacopoeia the formulations was in a standardized manner procured and tested and given to us by RRI Chennai. Then all the ATT drugs we procured, did an assay so as to have the quality checks on the drugs used and at NIRT Chennai and gave it to the Jalma to do the animal studies. So all this, most of the experiments were done in a blinded manner, and all MIC levels of ATT were observed. Next. So the first antimicrobial activity which was done in NIRT lab, we have concluded this part. So what we have done is, we have taken a lab strain which is nothing but MTB H37RB. This is a lab strain of drug sensitive MTB. So in this we have put the drugs individually as well as in combination, as well as in various concentration, and we have recorded the antimicrobacterial activity in this. Next. So this is by MIC determination with microdilution method. So we have done with all this, both the drug individually as well as together. Next. This is an ex vivo study yet to be performed from the blood of the animal sacrifice. So we are waiting for the blood to be transported. So we will be seeing all the cytokine effect to have the immunomodulatory effect establishment by quantified interferon gamma, TNF alpha, IL-6, IL-2, IL-8, IL-17, IL-22 and MMP proteinase. Next. So this is this part is in vivo animal study which is ongoing. We are about to complete. So all this drug preparation for animals, drug compounds, all this has been done, and now the animals are fed with, and we are about to sacrifice. So we would be getting data on this. Next. So these are some of the in vivo group experiments in which we have around 9 groups of animals with various combinations as well as with various dosages of the Unani Pharmacopoeia formulations. Yes, so we have found certain doses has effect and certain doses doesn't have effect. So we are about to have some results in this. Next. So this is our last objective, determination of immunomodulatory activity of Unani formulation in pigs. So this will also be taken care when the animals are sacrificed. Next. So these are some of the milestones. So we are left out around 9 months still to go. Next. So we hope the study outcome will generate a preclinical data on whether we can combine these Unani Pharmacopoeia formulation with the existing ATT in category 1 ATT treatment. So this will pave way for an add-on therapy in tuberculosis cases, may also benefit patients in ameliorating the side effects as well as good efficacy. Next. So this is one of the update of study progress. As I said, we tested both the drugs, but one drug with had efficacy of UPF against MDV was determined. With two drugs, we could find some effect, and that effect was given by Ash Harabara. So that has been studied and evaluated in the animal studies also. So the animal studies are ongoing and nearing completion. We will be having in another 3 to 6 months that data coming up. Next. So the way forward, when we complete this study, we want to take up a pilot a study on clinical evaluation of co-administering this formulation with ATT drug in TB patients with drug-sensitive tuberculosis. In terms of, you would see the safety, efficacy, and pharmacokinetics studies also in human to say that the drug levels are maintained and overall quality of life is maintained. Next. So this is my last slide. So you can relax. So to the council, I think this is I go to every council because being a patronage of Ayush system, and I have worked as a medical research officer in CCRAS around 15 years ago. So with that experience, I go to Ayurveda Council, I go to Siddha Council, I go to Unani Council and all Ayush councils with various agendas, programs. So this is one of my pet slide I say to everybody. So you are budding physicians, scientists, researchers. Whenever you see a patient, have the data. Please have methodological documentation, have those data. That is very important. We make claim. This is not the era. We have the classical books. Yes, they were documented, we have. But now the era is changing. Everybody needs evidence. Everybody comes to you with Googling. They don't come to you without knowing anything. They Google everything, X, Y, Z, plus, minus, everything. Then they will come to you. Convince them to have a treatment. At times, you may find yourself confused. So, try to have your own data. Try to publish it. So, I know council has treated lakhs together patient, maybe having in HMIS system. Kindly dig it up. Put it in global arena, some 10, 20 papers on safety interactions of whatever has been done as a retrospective study. So when a patient walks in for an ailment, make sure his history of care concomitantly taken from all stakeholders. So if a patient is coming to you, it means, as we were discussing, they shop for every treatment. Don't think he is the first person interacting with you as a physician. No, he would have interacted in his family 4 people, outside his family 4 people, he will be coming for 7th person. So he must have gone to all these clinics. So document all clinical findings, interactions carried out and interventions carried out. Continue recording over a period of time. Analyze retrospectively these interventions and patient care seeking behavior and satisfaction, etc. And this would be a ready reckoner that our drugs are safe even in interactive mode without even going for an interaction safety, interaction efficacy, etc. So please have this data taken up from the councils and also. Thank you so much. Thank you.